Hi, I'm Jonathan Cardin. I'm a dentist at Clock Tower Family Dental here in Castle Rock, and this is Dr. Kevin Wright.
I work with Amos Oral and Maxillofacial Surgery, also here in Castle Rock, and Dr. Cardin and I wanted to get together and take a few moments to explain what it is that we do, why we're passionate about it, kind of explain some of the interesting facts about dental implants, what they can and can't do, and explain why we enjoy doing this.
We work together on a lot of cases, particularly on patients who are looking to replace their teeth. We have a lot of patients who come in with dentures or are looking for implant dentures, and we just wanted to talk through the pros and cons of each of the types of solutions that are out there for different folks, and some of the cases that we've done possibly, as well as just the common questions that we get answered. So Evan, oftentimes, this process will start off with a patient coming to me. They've either seen one of our videos before, or they find us through somebody that we've already treated. And a lot of times they just want to know, they want to have a good smile is a lot of the time what they come in for. The other big topic I get, or big question I get, is I want some teeth that look great, but I can also use. So can you talk through some of the options that we offer?
For a patient who is in a situation where their teeth have been breaking down maybe for a number of years, and we've determined that it is time to take that step to remove the remaining teeth, there are various options available for replacement of teeth. Those go from a common denture, which most people are aware of, all the way up through the use of dental implants to provide either a denture that then snaps onto those implants, which we call an overdenture or a locator, all the way up to what you may see of advertised as all-on-4 or teeth in a day. And we call that a fixed hybrid. And that is really pinnacle of dentistry at this point. It's the closest replacement for a full set of teeth that we have to offer and can provide the closest thing to being able to chew in a natural diet.
That's right. I call it an implant denture or a screw-in denture because the teeth, it is technically a denture, but the teeth screw into implants. And the reason why that's nice is because when a patient truly wants natural function that's as close to their natural teeth as dentistry can provide, that is the solution that Dr. Wright talked about. That's the pinnacle of what dentistry can offer. If you want to chew into an apple or basically eat anything that you want to eat, that's the solution that we offer. And it is, as he was saying, the most natural, the most aesthetic, the most lifelike teeth that we can provide. And it really is a great option and great answer for a lot of people. And the patients that we've done this on, I would say, are extremely satisfied and pleased with the result that we're able to achieve for them.
Can you explain a little bit why a person would opt for a screw-in denture with utilizing implants over a traditional denture?
That's a great question. So when we go through this discussion in my office, typically we'll go through all the options. A traditional denture is just the denture that many people are familiar with. Maybe somebody who's had a traditional denture, the joke I use is you sleep here, your teeth sleep next to you, meaning that the teeth have to come out at night. Those are nice in the sense that they're relatively inexpensive compared to an implant denture. The downside is that it is a chewing power or amount of function that you get with a traditional denture is much less than what you get with a screw-in denture. So the roundabout numbers I use is if you're used to eating something with your natural teeth, you get 100% chewing power. You may be only getting 10 to 20% of your chewing power with a traditional denture. The next set of dentures that we talk about is what's called a snap-in denture. And that's where we take a traditional denture that looks like this, and then we attach it with these little attachments that go on the inside of the denture to a set of implants. Usually that's 2 or 4 implants, and that snaps into place, and you can see allows these traditional dentures to stay in much better. And for those patients, the roundabout number I will use is that you may get 50 to 75% of your chewing power. It's still a plastic denture in all reality, and it's a great option as far as a mid-level option for people who want still a good solution to be able to chew into things, but not at the price of an implant denture. The implant denture, what's nice about that is it's typically not made out of plastic, it's made out of porcelain, and you don't have, on the top, you don't have a palate portion, which is really nice for patients who are used to wearing a traditional denture where they have that palate portion, and sometimes patients will complain that it interferes with the taste of their food or it feels like a lot of material in their mouth. The bigger benefit of that screw-in denture is that you're able to chew anything you want to eat. And again, the analogy is that you sleep here and your teeth sleep with you. They stay in, and the only time they come out is when we determine that they need to come out.
One thing I like to tell patients is a traditional denture that comes in and out at night is not a replacement for teeth. It is a replacement for no teeth.
Right.
It's better than having no teeth. When we start talking about the screw-in denture, now you're actually starting to talk more about a replacement for your teeth.
Correct. I'd agree with that 100%. The other analogy I'll use is that we can decide what shape and color the teeth you want with much greater control with the screw-in denture, because it's much more customized than a traditional denture. A traditional denture still is custom to fit to you or any situation, but because we are working with ceramists, we're able to dial in the aesthetics of those teeth to a much finer detail.
Another point I like to bring up, a lot of patients are concerned or have anxiety or they're scared about the surgery part of the procedure, the pain involved afterwards. And they would think, a lot of people think, oh, implants and this larger surgery might be more uncomfortable. But it's actually been my experience that people tend to be more uncomfortable when you remove the teeth and put a denture on, because you're sitting a denture that can move on top of your gums as they're trying to heal, and that seems to be very uncomfortable for people. When we have the screw-in type denture, you'll see that advertised as teeth in a day. So you come in the day of the procedure with your natural teeth, the teeth are removed, the implants are placed the same day, and you walk out with a version of the teeth. It's not the final version, but they look very natural and they're quite aesthetically pleasing. The looks are good, but they are screwed onto those implants right away. And what I've found as far as a discomfort standpoint is that being screwed firmly into place protects the gums underneath as they're healing. And these patients tend to experience a lot less pain than if we were just sitting a natural denture on top of it. So even though it is technically a little bit larger surgery, it is much less post-op discomfort in my experience.
I'd agree with you. As I see some of our patients back to adjust the denture that has gone in on the day of surgery, I will say I've had very few complaints as far as the amount of discomfort. In fact, I've had quite the opposite, where people were expecting a lot more discomfort than what actually took place or what was the reality. And so that's been great. Can you also talk a little bit about Exparel and how that works in your office, that long-term anesthetic solution?
Sure. So anesthesia and post-op pain and management of that post-op pain has come a long ways in the last few years. One of the things that we utilize a lot in our practice is a product called Exparel. And Exparel is a local anesthetic like we use to numb you up anytime you go to the dentist and have a filling done, they numb you up. It's the same type of stuff, but they've engineered it such that it's in a slow release form. So we inject it while you're under anesthesia asleep, so you're not aware of that being injected, but it keeps the gums in the areas where we worked mildly numb for the first 3 days or so post-operatively. And that first 3 days has been shown to be the time when it's usually the most sore, because you're going through that inflammatory, that post-op response. And by numbing that area during the most critical time of post-op pain, removes probably 50 to 60% of the discomfort. So it doesn't mean you can't feel anything for that 3 days and that you're completely numb, because there's a lot of people that don't like feeling that profound numbness for that
Right.
extended period of time. It's not quite like that. It's just mildly takes the edge off, and people have been really pleased with that, and it's helped their recovery. Another thing I've seen in dentistry, we work in the mouth. There's food in the mouth. Everybody has naturally bacteria in their mouth. And so post-operative cleaning and hygiene after the surgery is paramount to making sure we have a good result and that things heal properly. And I've found that when people are slightly numb with that Exparel medication, they do a much better job of post-op hygiene. And so we see better healing, less chances of infection and things like that. So it's not only just for treatment of discomfort, but it also helps the healing of the surgery afterwards, because people do a better job of cleaning.
Right, and that makes sense when you get a double benefit. If someone is having a lot of discomfort and pain after the process, they're not going to want to touch the area. But if that is diminished or minimized or not there, then it's much easier to keep things clean, and that also helps the healing process move along a lot faster as well. So sometimes I'll have patients ask me, well, am I going to be awake for this procedure? Can you talk through some of the sedation options that you offer?
As far as general anesthesia or sedation, we offer a few different ways of doing that. For smaller procedures, there's actually a certain percentage of the population who has anxiety about going under anesthesia, and I don't want people to think that they must go under anesthesia here. But we are very good with our local anesthetic techniques for smaller procedures and can get people very comfortable. They're obviously would still be awake in that scenario, but they're very comfortable. My joke is that if something's bothering you, just reach up and smack me around a little bit and we'll make sure we get you comfy. But for smaller procedures, that's still an option. So if that's something that being under anesthesia makes you anxious, that's not something you must do. But for these larger procedures and even for the small ones, we offer what we call a conscious sedation or a twilight sleep. The most common thing is a lot of people are familiar with colonoscopies and things like that, where we start an IV in your arm and provide anesthetic through that IV and you drift off to sleep. And most people are literally snoozing like they're asleep at night, have no memory or awareness of the situation that's going on, but it's a safe way to do anesthesia in an office situation where you still have a high margin for safety, but the patient's very comfortable and unaware of what's happening. For our even larger procedures, we also offer full general anesthesia where we bring in and board certified anesthesiologists who work with us. And in those cases, you're asleep as if you were at a hospital. Say you're having a hip replacement done, and you're going to be under full general anesthesia. We can provide that same type of care here where you're completely asleep as if you were at a hospital.
That's nice in some cases in the sense that the anesthesiologist is the same guy that you'd have if you were in a hospital getting some other type of surgery. And that's been a very nice and convenient option for us. You're getting that same level of care. So let's talk a little bit about other options. Let's say someone just doesn't want a denture in any sense. They don't want a plastic denture that goes in their mouth or even a porcelain denture that screws in that's all connected. There's another option that's offered if we're not replacing, well, this can be if we're replacing all the teeth, but quite oftentimes, let's just say someone is missing some of their teeth. They're not missing all their teeth, they just need 2 teeth replaced. In those scenarios that we'll offer maybe a combination of a single implant or implant bridge is what we call that. So that would be like 2 implants with 3 teeth stuck on them. And I think we have an example of that here. So this is an option where if someone's missing a single tooth, we would put in a single implant. If someone's missing more than 1 tooth, we can put in an implant bridge. So those are other options. Not everybody needs all their teeth replaced. Most people, I would say, actually just need a couple of teeth replaced. And in those scenarios, that would be the solution that we offer.